Injuries happen, it's just a fact of life. Whether it's a niggly back or a sprained knee, we're all going to sustain some form of injury over our lifetime. Now, while injuries do need time to recover and heal, there are not many instances or conditions, injuries that would warrant complete bed rest. So today I want to talk to you about how exercise can actually help to improve recovery rates. Movement and exercise play an integral role to the recovery process. By completely resting an injured site, we're reducing any sort of load that's being placed through the area, and this is going to slowly atrophy the area and make recovery processes that much harder. So if we're slowly loading the injured area and placing volume and stress to that site, our tendons, our ligaments, muscles and bones, they all respond positively and they start to build up again nicely. And this is going to help with the recovery process. So by completely resting an injured site, we're often doing more damage than good because we're not giving our body the chance to respond to this mechanical stress and get stronger again. So unless there is a reason for completely coming off any sort of weight bearing, make sure that we're slowly putting some sort of load and mechanical stress through the injured site. And this is going to give that injured body part an opportunity to get stronger again. By moving the injured site through tolerable ranges, we're also improving and increasing blood flow to the area. Now, an increase in blood flow helps with our inflammation process, important for recovery, and it also brings along with it all of the important nutrients vital for recovery. So this is our protein, our oxygenated blood, and our immune fighting cells. So all of these are really important for recovery, and this is increased when we are using the muscles in that area because more blood flow is coming to that site. So by moving that injured body site in a tolerable range, we're actually helping to promote blood flow, and this helps to promote recovery. Now, our range of motion, our muscle size, and our mobility can all be compromised if we stop exercising due to an injury. Now, unless a surgeon, a doctor, or an allied health professional has told you to completely immobilize the area, we should be trying to move it through gentle ranges and place stress and load on that area as best we can. For example, if we have a sore knee, if there's pain in the knee and we decide off our own back to completely immobilize it and stop weight bearing, what you'll see over time is that the quadriceps at the knee will start to weaken and reduce in size, and you might also see a reduction in full knee flexion extension, and this is going to be at a detriment to your recovery. So what we need to be doing is moving through those ranges and placing small amounts of load through the area as best we can. Now, having good mobility, good range of motion, and maintaining muscle strength, this is also going to have a really positive effect on our recovery times. So try not to immobilize that area just because we're feeling pain. It's really important that we move through our ranges as best we can. So moving on to pain, remember that exercise is medicine. When we exercise, we actually boost the production of endorphins. Now, endorphins interact with our opiate receptors in our brain, similarly to our pain medications such as codeine or morphine. So during exercise, this boost in endorphins can actually act as a pain reliever. Not only are you going to be able to exercise in a more pain-free manner, you will also experience a reduction in pain following exercise. So exercise is going to be a great pain reliever for you to help manage your symptoms and move through your rehab program at a better rate, feeling more comfortable. So to summarize, we almost never recommend no exercise or no movement for an injury. We will almost always recommend some form of exercise that's appropriate for you. Now, that doesn't mean that you need to be going at 100%. you're probably going to run the risk of further injury or damage or an increase in pain. So it's important that you have a chat to an exercise professional or someone that can help you with your rehab program, so that a program can be designed specifically around your current pain levels, your tolerance, that specific injury, and what your goals are.